I have good friends. We play tag. Sometimes we argue. I like my teacher, Miss Johnson, because she helps me and she helps Nico when it's hard for us to do what the class is doing. And I love my doctors, even though they give me shots that I don't like.
My son Kyle faces environmental allergies, asthma, migraines, and severe combined ADHD. For close to 3 years, we were treated by emergency room physicians. And when you're dealing with something without the insurance and you can't get the help and you can't get the answers that you need, it's very, very hard. It's hard as a parent, especially as a single parent, to make a decision as to what bill do I not pay, what do I provide. And when you're doing that, when you're playing that kind of roulette with your child's care, that's not the care that a child needs.
Today, there are approximately 8.3 million uninsured children in the United States. The majority of those children are eligible for the Medicaid and the state child health insurance program. I mean, there are families out there all over America that haven't a clue that this help is available for them. We've been working hard on trying to simplify the system to move forward with some aggressive outreach.
You can send this form out. It already has a postage stamp on it.
Is the visits free with the CHIPs and Medicaid?
We have done, I think, a fabulous job through covering kids and families to get the word out that these child health coverage benefits are for children in working families. That's what they're intended to be. And it has evolved into a very sophisticated campaign where it's focused around the back to school time, which is a time when parents are focused and other caretakers are focused on the children. And during this period of time, they'll be out and about in grocery stores, in schools, and many other places to try to enroll families.
I was attending the Museum District Day at the Houston Museum of Natural Science, and they had a display that I went up to find out more information. And the first question to me was, did my child have insurance? And I said no. And they said, you need to take an application with you and see if your son will qualify. And it was the greatest thing that I did.
Today, when they walk up to that outreach table, they're going to find very family-friendly materials, something that looks totally the opposite of something that government, might offer. The applications themselves have been simplified. There's the 1877 Kids Now number, which consistently has shown that it spikes during the period of back to school. All parents want to take care of their children, regardless of their income level. When you look at the cost of health coverage, family health coverage is about $12,000 a year. You can earn minimum wage and work all year round, 40 hours a week, and you're making less than $11,000 a year. You can't afford coverage for your children.
Now that we have access to medical coverage, my son is not missing school as he has done in the past. There were semesters he was gone 10 to 20 days at a time. Well, with a CHIP plan, we're able to be with a pediatrician who we really like working with, and he has watched my son grow into what he is today.
When the Robert Wood Johnson Foundation started covering kids back in 1997, there were about 11.5 million uninsured children in the United States. Today, there are approximately 8.3 million uninsured children. And that's a 20% gain in the number of children in the United States that have health coverage.
My son would not have flourished in school as he has. He would not be able to maintain the personal relationships, the friendships. His life would not be something that I would want for any child without the insurance.